for the day. Welcome again. And for those of you who are just joining us, my name is Mark Ricci. I have the honor of serving as president of Global Minnesota and your host today. Global Minnesota is able to bring this to everyone on the world for free because we have great support. Our program partners, the World Affairs Council, the partners, the World Food Program, USA office, but also corporate sponsors and people who were generous enough to support today's experience directly. McKnight Foundation, Regenerative Agriculture Foundation, Blue Cross Blue Shield, Greater MSP, King Solution, and Hormel. At the end of today, there will be social hours, opportunities to hear about some very interesting subjects and topics, chat more informally with people. They're going to happen right after we close the official program. There'll be a little bit of time. There's a whole list of them on the Global Minnesota website under the World Food Day agenda at the very end. Check it out. It's going to be a chance to hear about a lot of amazing things that are happening and to really connect with the people who are making those things come alive for us today here on World Food Day. This next session is about people on the front line who are taking seriously the connections between the campaign to try to reach that goal of zero hunger by 2030 and the other sustainable development goals that have to be folded together. We've heard this all day long, how things need to be put together. Education, equity, health, all of these things fit together in one package. Alexandra Spieldoch, who's the executive director and president of Bountifield, is one of the key leaders on the planet who thinks about the integration of the Sustainable Development Goals into the broader global context. And I'm so thrilled and honored that she agreed to moderate this panel today to tell us about Bountifield and that work. And I know that's one of the social hours. And then to bring into this conversation the idea, the larger picture of how the Sustainable Development Goals that we all are working for move us towards zero hunger together. Thank you very much, Alexandra. I turn the microphone over to you.
Thank you so much, Mark. Thank you to Global Minnesota, and I'm so honored to participate in this day and had the honor to listen to all of the different presentations since this morning, and also to just moderate this distinguished panel this afternoon and this important topic. As Mark mentioned, I'm CEO of Bountifield International, which is a global nonprofit that's based in Minneapolis with programs in sub-Saharan Africa. And we are focused on ways to help small farmers and rural communities save, preserve, and sell more food, focusing on staple crops that have tended to be forgotten but are highly nutritious, grow in climate-challenged regions, and are also part of local diets and rural livelihoods. These crops include grains like millet and sorghum and legumes, and they're quite difficult to process. And throughout sub-Saharan Africa, they are being processed manually in most cases, and they're being done manually by women in most cases. So we look at that intersection of technology and sustainable development goals, the importance of multi-sectoral approaches and partnerships in the rural sector. And we're proud to do this. We come out of General Mills, and we were founded by a food technologist who saw how practical solutions and leadership can play a huge role in decreasing food loss and improving food quality and availability of food, of quality food, as well as thinking about things like inclusive growth and opportunity where it's lacking. So without further ado, as Mark mentioned, this panel is about hearing from the front lines and its SDGs and food security. So hearing from the front lines, what does that mean? It's the opportunity for us to learn about the SDGs, how they are being developed as a framework for work, and also contributing to program implementation throughout the world. And I love this panel because of the distinguished leaders that we have, but also because we get the honor of hearing from them from their regional experience. And I've asked each of these speakers to talk about SDGs more broadly, how it came to be in their own context, and then also to, again, speak to their experience with some stories along the way. We'll have a question and answer session at the end. And I'm going to start with David Miller. David Miller is a principal community relations consultant who is working with Blue Cross and Blue Shield of Minnesota. And they are specifically developing a whole framework around sustainable development goals that they can then implement across their programs across the state. And what's so exciting about this is that it's a model that we're seeing being spearheaded from Minnesota, but also with great potential nationally and perhaps for other contexts. So without further ado, I'll hand over the microphone, so to speak, to David.
Thank you, Alexandra, and good afternoon, everyone. Happy World Food Day. My name is David Miller with Blue Cross and Blue Shield of Minnesota, and I'm honored to be here today to speak about food security and the Sustainable Development Goals. As we've learned, food insecurity is an issue that impacts more than a quarter of people around the world. The number is closer to half in low-income countries. Here in Minnesota, considered a high-income state and a high-income country, even we have about 1 in 10 Minnesotans that struggle with food security. The ripple effect of food insecurity reaches all aspects of our lives, including our health. The intersection between good health and well-being and food security is well documented in research. Those that are food insecure need to make difficult economic decisions daily, choosing between food and other necessities. Families struggling with food insecurity have higher rates of health disparities like obesity and mental health and well-being. To ensure healthy people and communities, Blue Cross and Blue Shield of Minnesota believes equity and food security are critical elements of our mission to inspire change, transform care, and improve health. The best care is preventative care. That is why we are focused on upstream health factors like food security. Next slide, please. About a year ago, Blue Cross started to map our work to the United Nations Sustainable Development Goals. We are exploring a long-term plan of making the SDGs a framework that we can measure success, especially in the areas of good health and well-being for all, zero hunger, and climate action. Our corporate social responsibility strategy, which we call social impact, has clear connections to SDGs. We have focus areas including community, healthcare, and environment that we view through the lenses of the social determinants of health and racial and health equity to guide our social impact. Similarly, most healthcare organizations who are mission-based, like Blue Cross, are well positioned to positively influence good health and zero hunger. At Blue Cross, there are specific ways that we are approaching good health and zero hunger, including employee engagement, corporate giving, and community programs. Next slide, please. Two examples of employee engagement include volunteerism and giving. Our employees receive 20 hours of volunteer paid time off each year to use in service to their favorite causes and charities. This year, due to COVID-19 pandemic, racial justice movement, and economic crisis, our company has increased available VPTO to 40 hours. Last year, more than 17,000 hours of volunteer service were provided to the community. Many of those hours were given to charities that support food security. We host 2 employee giving programs during the year. The first in March is Minnesota Food Share, a statewide food drive. The second in September is our community giving campaign. We had record-breaking giving from our employees in both campaigns this year, along with a Blue Cross and Blue Shield of Minnesota Foundation match. We raised nearly $1.5 million for more than 600 charities, many focused on food security. In fact, this year, to encourage giving to food security and racial and health equity organizations, the match dollars were increased for 7 nonprofits. Next slide, please. 2 examples of corporate giving include grants and sponsorships. Blue Cross provides more than $15 million in grants and sponsorships each year, most notably for food security. The Blue Cross Foundation announced earlier this year a $750,000 commitment to Second Harvest Heartland, a Minnesota food bank. The foundation also is contributing $1.1 million to support communities during the COVID-19 pandemic, specifically communities of color and indigenous communities, people with disabilities, immigrants, refugees, domestic abuse victims and survivors, and the LGBTQ community. Next slide, please. Two examples of community programs include the Community Giving Gardens and the Food is Medicine program. Blue Cross invests in healthy communities through our Community Giving Gardens to address systemic, societal, racial, and health equity issues of food insecurity and accessibility of nutritious food. The Giving Garden program is centered on environmental stewardship, building community resilience, and encouraging volunteerism. Most importantly, it provides fresh produce to families in need through nonprofit partners. Our Food is Medicine program, meal delivery service, provides tailored fresh foods for seniors on Medicaid and medical assistance with chronic conditions such as diabetes and heart disease, or who might be recovering at home from a hospital stay. This program is all about the interplay between nutrition, quality of life, and maintaining health for our seniors. Finally, research shows that our health choices and physical environment are connected. The air we breathe, the water we drink, and the land we farm is clean. When it's clean and sustainable, it benefits the planet, our food supply, and the health of our community. I am pleased to announce that last year, Blue Cross committed to reducing Scope 1 and Scope 2 carbon emissions by 25% by 2025. And in 2019, we had already reduced our carbon footprint by 15%. I have been fortunate enough to witness firsthand the power that healthcare organizations can have on food security. Prior to my current position at Blue Cross, I worked at a basic needs nonprofit, which provided families with food, housing, and economic assistance. It was because of organizations like Blue Cross that our community-based nonprofit could serve the more than 500 families that needed help each month. Blue Cross sent volunteers to pass out food to families in need and provided funding to purchase food when donations were low and to keep the doors open and the lights on. I am happy to share with you today that healthcare organizations like Blue Cross do have a role to play in impacting good health and zero hunger for all. Thank you. Thank you, Alexandra.
Thank you so much, David, for sharing the leadership that's coming out of Blue Cross and Blue Shield. And I had lots of questions that were coming up as you were talking. I'm sure we'll have a chance to get into that in just a few minutes. But I'd like to go ahead and introduce our second panelist. Our second panelist is Víctor Suárez. Víctor is the Deputy Secretary of Agriculture within the Mexican Secretariat of Agriculture and Rural Development. He is a longtime activist and friend to many in the Minnesota community. He is the Executive Director and founder of the National Association of Rural Commercialization Enterprises, ANEC, in Mexico. Since 1995, and really since the NAFTA era, he has promoted a strategy across the country to develop agricultural markets with small and medium-sized producers of grains with more than 50,000 members. He launched an activist campaign, Sin Maíz no hay país, without corn there's no peace. And he's also served in the Mexican House of Representatives for the Party for the Democratic Revolution. So experience in the private sector as a producer, experience with the government, and he has experience in Minnesota as well, and globally in terms of all the different forums and panels that he's been invited to speak at. And we're so honored to have you here today. Thank you, Víctor.
Thank you, Alexandra. Good afternoon. I'm very grateful for the opportunity to participate in this forum that commemorates World Food Day. Thank you to Mark Ricci, Alexandra Spieldoch, Carolina Gustafson, and everyone in Global Minnesota who makes this important event possible. I'm very happy to be here with a very old and close friends of Minnesota, especially my very old and close friends of Institute for Agriculture and Trade Policies. Especially, I'm very happy to be with Mark Ricci, who is in different sense a master of our struggles, peace and struggle in Mexico in order to achieve food security and food sovereignty. The current government of Mexico, in force since December 2018, has clear transformation goals in all areas of public life, and rural and food policies are not exception. In recent decades, we have experienced an inertial situation in the countryside of programs and subsidies without social sense that were concentrated in the larger scale producers. Small and medium scale farmers were bypassed despite contributing more than 50% of the country's food production. Likewise, in those past decades, indiscriminate access was given to ultra-processed foods with excess calories, sugars, fats, and sodium, which quickly gained space to traditional Mexican foods, proven healthy and nutritious. All these deepened the historical, social, economic, regional, and urban-rural inequality of Mexico and caused greater poverty and rural migration. Small-scale farming was discouraged, and local markets and consumer sense of gastronomic taste were distorted. The transformation that we are initiating in this government is long-term. It consists of a new fair, healthy, sustainable, and competitive agri-food and nutritional system. The new agricultural policy has two priority objectives: food self-sufficiency and the rescue of the countryside established in the National Development Plan 294. Today, the government has reoriented public resources for agriculture in favor of small and medium producers, mostly present in the South and Southeast region, and they are exercised through priority programs such as Production for Well-being that manages the Under-Secretary of Food and Competitiveness under my charge. Production for Well-being consists of delivery of direct support per hectare to 2,100,000 producers of corn, beans, wheat, rice, other grains, coffee, and sugar cane. These resources serve for producers to invest in their work in the field, and today they are invaluable as they cushion the health and economic crisis caused by the COVID-19 pandemic. But Production for Well-being also has two strategies, one for technical support and the other one for promoting access to formal financing. Here, I focus on the technical support strategy because with it, we seek a transition to sustainable agricultural system and agroecology. We have 600 agroecological technicians who work side by side with producers from 23 regions, mainly indigenous, with high and very high levels of marginalization and situation of violence. The technicians train producers in the preparation and use of bio inputs such as compost, worm leachate, and preparation with microorganisms. We note that this technical support is welcomed by the producers. There are several reasons. Modern scientific knowledge is shared with that of producers, which they have inherited from several generations and which implies a deep respect for soil and water resources. The transition to sustainable practices has in practice beneficial results in every way. We have confirmed this in our strategy. Producers use biological resources that they have in their own locality as inputs and gradually reduce the use of agrochemicals. This allows them to lower cost and dependence on foreign inputs. The soil resource of the producers is regenerated as they stop using agrochemicals, they stop pollution, the water bodies, and their yields and harvest rise. An additional stimulus, and perhaps the most important, is that producers, and particularly women, value that their crops are healthy, that they can consume them with confidence. They are crops without agrochemical content. All these, of course, contribute of food security of peasant families, communities, and the country. This year, in Mexico, we are forecasting a production increase of 8% compared to 290 in the main four grains, corn, beans, wheat, and rice, which will add 34 million tons, of which 2.9 million will be corn. The increase is based on good weather conditions. We have excellent rains, but it also, of course, explained in the support of the government's priority programs, including production for well-being. The other priority programs for the year field are sowing live, guarantee prices, basic basket, and fertilizers. The construction of a new agri-food and nutritional system is a strategy of the government as whole. It transversally involves several secretariats or ministries, such as the environment, health, economy, education, and welfare, among others, as well as civil society organizations such as the Alliance for Health and the Power of the Consumer, and international institutions such as the FAO, UNICEF, and the Pan American Health Organization. All are integrated into a group called the Interinstitutional Group for Health, Food, Environment, and Competitiveness, HISAMA Group. This group has borne in its first fruits with the frontal labeling of processed foods. This is several stamps that, by obligation, as of October, must carry foods high in calories, saturated fat, sodium, and sugar. They are also warning stamps for foods that should be not consumed by children due to their caffeine contents and sweeteners. Hisama Group also works to phase out highly hazardous agrochemicals such as glyphosate. This has led to a controversy and attack on President Andrés Manuel López Obrador, but that the decision has been made. We want to protect the population. We want to take care of their health, and the government will not give in to pressure. Glyphosate must be discontinued within 4 years. So this coupled with social legal process that have so far managed to stop the planting of transgenic corn show us that the government of Mexico is committed to the production of the field with the production of food, with the perspective of more and better, more production, but healthy and sustainable, and policies that pay to bring healthy food to the population free of toxins. Thanks so much, everyone. Thank you so much.
Thank you so much, Victor. And I'm excited to hear about all of the initiatives that are underway in Mexico and the comprehensive approach that's being taken by the government. You've raised a lot of different issues, and perhaps we can get to, again, some of those during the question and answer section. Next, we're going to hear from Atul Tan, who is the CEO of Opportunity International. He is bringing 35 years of experience and leadership across a range of organizations, from nonprofit to the profit sector, ranging from World Vision, United Ways, Global Network, as well as Citibank in India, experience with finance and credit, et cetera, and now is talking to us from Seattle, Washington, to tell us a bit more about how Opportunity International, which is a highly respected global nonprofit with programs around the world, is addressing the SDG framework and understands that and how that's playing out in its programs more specifically. So without further ado, I welcome you, Atul, and thank you so much.
Thank you so much, Alexandra. Thank you so much for having me. And of course, to our friends at Global Minnesota, thank you to Mark Ricci and to the team. One, for organizing this day, for caring for the world's poor, the hungry around the world, and putting them on the map. I have to say the outstanding collection of speakers and luminaries you've had, and now you're stuck with me. So but it really has been, the morning session with Governor Beasley, which you got off to such a great start. I mean, just an inspirational person, listening to Professor Sachs in the afternoon. Very inspiring, very informative. And I want to talk about that. It's Opportunity International, though, nonprofit I lead today, and I really am humbled to lead today. Very involved for 50 years in addressing at the very root cause both the issues that are intertwined here. One, SDG number 1 and SDG number 2, poverty and hunger, that they go hand in hand. And, as Governor Beasley pointed out, what is not said, that both poverty and hunger lead to conflict, right? There's a direct relationship there. So reducing hunger and poverty to reduce conflict, or other way around as well. But that's what we have done for 50 years, is to give families, specifically at the very bottom of the pyramid, the means that they need, the resources, financial resources, training and support to build sustainable livelihoods. Because if you think about hunger, well, how do you solve it on a sustainable basis? You've got to make sure that the people at the bottom of the pyramid have the economic capacity to purchase the food that they want, that they have the technical skills that they need and the support that they need to grow the food that they want, and then to be able to consume it and to sell it, which is what we do. And the context we find ourselves in, Alexandra, today, which I think has been so well communicated today, is on the one hand, all of us, together have made progress over, I would say, the last 30 years in beating back both hunger and poverty. Right? If you start off just in 1990, about somewhere between about over 2 billion people, 37% of the world's population, going to bed hungry every day. Right? Almost 40%, you could say. In my home country of India, where I grew up, when I was born in the late 50s, early 60s, over 80% of the population going to bed hungry every day. Those numbers had come down by the end of last year to about 700 million people. Right? So we released about 1.3 billion people from that hardship. The impact of the pandemic in just 1 year, or not even that, in the 7 months, and it's not over yet, we are now projecting somewhere between 100 to 130 million more people who are now in extreme poverty and are not able to purchase food. Of them, close to about a third of them, 250 million, might be at the risk of starvation. So we face an extraordinary humanitarian crisis, which comes though with 3 decades of progress behind us. So when I put those two things around, and I want to talk about what we do as an organization, is we know how to solve this problem. We have beaten this back before, both hunger and poverty, and we will again. And when you talk about how we will again, is where I want to go, is today, survive today and thrive tomorrow. That's the theme of our organization's mandate, I believe, as we look at our work. What are we doing to help these families survive today? Well, we have about 17 million clients and spread across about 28 countries. We work through a network of local partnerships, about 75 of them, and financial institutions, banks, other intermediaries. In fact, many of the corporations in your own home city are our partners, Cargill being one of them, and I could go down that list, have been for many years. So what we are doing there with these families is in effect, a 3-part plan. One, we want to make sure that you preserve your cash that you have, right? And make sure it's kept safe and you have access to it. So we have expanded access, electronic access to the small deposits, $32 of average savings that a family has in these communities kept in one of our banks, so they can access it electronically. 2 is, let's make sure that you're not having to pay off loans and so on. 7 million clients across the entire network, loan moratoria. When you have capacity to pay, when your small businesses start up again, you can earn your daily wages, you can pay us back, start paying us back at that time. Thirdly, let's make sure where you are risk of starvation, we actually get you connected either with people like WFT or our own selves. We are providing both the food services, but as well, in some cases, few cases, but in all cases, protective equipment and so on. So that's, as you look at today, that's the survival today. I'm reminded, Alexandra, our staff of all places, Cartagena in Colombia, not too far from here, right? We have a project in a slum outside Cartagena, and the roads are closed. There are curfews. We are allowed because we are a humanitarian organization. The people were starving, no food inside, right? There was a sudden curfew imposed. And so our staff had no other means except to actually withdraw money from their bank accounts, go to the local market, which was open, purchase the food, and then caravan into that slum. So if you think about, what drives the dedicated staff we have in many of the organizations here, I'm just so frankly humbled to hear those kind of stories of what actually happened. So we've stepped in those situations. Thrive tomorrow, though. You have to make sure that we solve this problem on a sustainable basis, right? What do you do there? I'll tell you the story of a woman farmer I met in Uganda last year. I was visiting our projects there, Millie. She's a widow. The husband left her when he passed away, a 5-acre coffee farm, 12 children to feed. And, she was at that time a young mom. And she took this on herself. So she has been, how do you feed 12 children? How do you grow enough coffee? How do you sell it? And she was chatting with me, and she'd been at it for a little while. She got connected with the opportunity. We showed her things to do, improve planting techniques, right? Improve soil, improve her irrigation. We connected her to a local co-op so she could get her the right price for her product. And then, to a local marketplace processor. Her complaint to me was, she said, we have started earning so much money. My kids have now gone to school. My son is a doctor. He refuses to come back and help me. Now you got to find him a job here. So when are you going to come back and create a health clinic so my son can come work next to me? So I said, Millie, you have the world's greatest problem, and I'm just so excited I'm here. And my prayer would be that we could together, Alexandra, hear Millie's story repeated 1 million times. And I think, to me, I'll close with that, is that we have the means today, between the technology, between the resources, between the networks, the solutions that we have, right? Resources, training, and support to help people. survive today and thrive tomorrow. The question is our will to do it. So thank you.
Thank you so much, Atul, and thank you to the other panelists. I love the stories and flavor coming from Uganda and Cartagena and Mexico. Really rich, and of course we need more time to talk more about these things. You know, throughout the day we have primarily focused on Sustainable Development Goals 1 and 2, you know, to end to get to zero hunger and to end poverty. Those of you who know me in the audience will know that I won't miss the opportunity to talk about the disproportionate impacts of global hunger and poverty on certain groups, and in particular on women and on children and on the elderly. And I really would like to spend a minute with the panelists to call out Sustainable Development Goal on Gender Equality number 5, as well as SDG 10, Reduced Inequalities, because, you know, I think we can't really talk about the work that we're doing without also talking about everybody receiving an opportunity, and about the justice component of our work. I mean, we can't allow for the kinds of barriers that we've seen in the inequalities to stay the way they've been. And so if we're serious about the SDG framework in the work that we're doing, what are some solutions that you have started to develop to make sure that this piece of the SDG agenda is not forgotten? And Atul, I will start with you.
Thank you so much, Alexandra. And you're right there is that, you know, it frankly is, it's been repeated many times, but it's a truism as well, is if you can, you know, equip a mom, you equip a family and then a village, right? And our solution has been recognizing that in the field, practically speaking, day to day, you have women who are globally earning less than they should for the jobs that they do, similar jobs that they do to. There's a real gender disparity there in income levels. There's a gender disparity in opportunity levels, what they can, whether it comes to education or you know, access to resources. So we have had a two-part response to that at Opportunity. One, we really focus on the women in the family. That they have the means to set up small businesses and run them. So approximately 90% of our clients are women across the world. And we can go back and demonstrate and show you. So example from Mozambique is, you know, after about 1.5 years in our program, I believe it was close to 97% of the women farmers in that program specifically came back and said, you know, not only has our incomes increased, but our standing in our family and our community has increased. We are more respected today, our voice is heard, and that's what we want to see. I would also talk about specifically about the girl child, and you spoke about education. You know, children as a whole, we all believe that they come first. It's one of the hard things to accept and observe in life is that's not the case everywhere. And even today with COVID-19, you know, at the peak, about 1 billion children were out of school, Alexandra. Under that number, 300 million children of those were receiving daily meals at their schools. Many of them, we are amongst the largest financiers of affordable schools in the world. You know, we had, I think last year, close to 4,000 of them, principally Africa and Asia. And you can see visibly the difference between a child who's receiving a meal at the school and who's not. So I think that's where our hearts and our minds are drawn to is, okay, how do we sustainably now in the response, one, focus and prioritize on women, two, frankly, even more urgently, let's make sure that those schools open so that the kids can both get an education and are able to receive the meals and do that safely. Right, so it's one of those situations where you've got to take both governments as well as communities have to take some good decisions about both those. Safety on the one hand, but you know, feeding the kids and getting them educated on the other hand.
Thank you. Víctor, I'm going to ask this of you as well. And in particular, you mentioned in your speech You talked about obesity and processed foods. You talked about a new emphasis with the Mexican government on more traditional foods. And I'd like to hear from you, if you're comfortable, talk a few words about how you see that impacting families, women and children, and the role they play as keepers of traditional knowledge and indigenous knowledge within food systems within Mexico, and how the government is helping to facilitate that.
Yeah, as you know, Mexico cultures, ancient cultures, um, were created maize and a different food plants, and they developed agriculture system named milpa. Milpa is a system who combine different food plants as corn, beans, and different 6 and 8 different plants in one hectare. Milpa system provide different food for the peasant family. And right now, we try to protect and to improve these traditional systems versus the ultra processed food system that had created in Mexico an epidemic of obesity and the malnutrition conditions. We support this traditional system with technical assistance, scientific links with the traditional knowledge in order to maintain and improve these conditions. We try to rescue different foods, ancient food like amaranto, like chia, and different and very lot different kind of food plants who represent a very healthy diet for the people. That's and right now we try to establish labeling for ultra processed foods and beverage with a very high sugar addition in order to inform the consumers who which kind of food they are trying to buy and to consume.
Thank you so much. I think I've received a couple answers to my questions, so let me move to another SDG, and that's the one around partnerships. And I would like to hear from David a bit about how how Blue Cross Blue Shield is partnering with other actors to promote its SDG agenda and its work within the Minnesota community, and how you see that as a model for whether it could be expanded nationally or for other healthcare providers, for example, to address food insecurity.
Thank you, Alexandra. And yes, we are, as an organization, we continue to focus on sustaining this momentum in our program by strengthening our partnerships with our communities and the global community. I believe that we can make a global impact, and it's only possible, as a statewide organization, when we can create the internal structures that allow for strategic partnerships and a culture of systemic change. Yeah, I would answer your question also by saying that Blue Cross is a company that truly walks the walk. As I mentioned, we're a mission-based healthcare company, and we take our partnerships seriously. We take our role in the community as not only a provider of health insurance, but also an organization that has the means to help impact food security and the other SDGs. And it's something that we're constantly working towards. Specifically, our partnerships, we have many within the nonprofit sector. As I mentioned, we have organizations that we volunteer with, that we give to in terms of our foundation dollars, in terms of our corporate giving, in terms of our employee giving programs. And with food security becoming at the center of attention, especially during the COVID crisis and the racial equity movement right now, this is something that is easy for us to pivot to, given our expansive network of nonprofit partners. And as I mentioned, we can elevate certain partnerships that we believe can make a direct impact in our community through different means. As I mentioned earlier, we have 7 featured nonprofits that were focused specifically on our food security efforts through our giving campaigns. And the work continues. So we look forward to continuing to integrate and align our framework within the UN SDGs. And it's important to be guided by this North Star that is recognized by the global community, because our local actions can align and also create a ripple effect with our global vision. Thank you.
Okay, I think I probably have time for one more question and answer round. I want to pick up the couple things, but this group talked a little bit before this panel discussion about how our work is often being done in a siloed way. It's one of the challenges if you're either you're a water expert or you're a food expert over here, or you're an agricultural expert over here, and all these things, or health for that matter, are interconnected. And so it's so important that we're thinking in this way. I mean, have you seen this kind of silo in your work? And have you made efforts, within your company or organization to address this? And Atul, I'm gonna come back around to you, but I'm gonna layer it with one more question to you, because I want you to speak a little bit as well about how you've brought in alternative financing, and you've also thought about some of the important work that needs to be done also around comprehensive thinking about investment strategies that help us to break out of those silos. So thank you.
Thank you for that, Alexandra. So I'll just a couple of brief comments, but before I forget anything else, I have to mention your previous question on women's empowerment. The Global Minnesota Chair, Muffy McMillan, who is as well serves on the Board of Opportunity International. She is our global ambassador for women, has been for the past few years, and in that capacity is, as we speak, currently leading a worldwide effort to reach out and impact the lives of 5 million women principally in Africa and Asia, one country, Colombia, and in Latin America. And that in turn, that very well underway. We are making great progress. If you think about it, that's 25 million people, five members per family. So hats off to Muffy. If I had time, I'd tell you all the stories of going with Muffy and 14 of her best friends, all women, to a very, very remote and very rough part of India. And the 12 hours we spent on a bus trip where there was, it was one guy and 14 women in the middle of India with no restrooms in sight for about 7 hours. So, it quite was quite the trip, but changed our lives. To come back to what you were talking about, what we saw on that trip and what you would see in Opportunities work is that what we understood very early on, we were born in the Midwest, and still are very much a Midwest-based organization, was the power of both market economics as well as the power of partnership, working together. So we have traditionally worked together with local partners, and from probably day one, tried to stay away from a silo mentality. And as you know, let's bring people together. And that's what we believe works successfully, sustainably. What it's translated to is that we also understood that you really want local players, to work together. And I know both David in his context with local players and Victor in his context with local players would agree with me. In our case, what we do is we take philanthropic capital, Alexandra, and then we use that to get local banks to do lending to the poor, the people whom we are serving, at appropriate rates and terms that are appropriate to the context of the poor. The result of which is you get maximum amount of loan capital, savings services, insurance, as well as training and support unleashed. So working in partnership, our best estimates are that philanthropic dollars get multiplied 12 to 15 times, versus if we were to simply go in and do all the work ourselves, which we could, right? So that's the power of partnership. Now, when you start to speak about investments, right, blended capital, how do we bring both local and foreign investors who are not philanthropy but are commercial into the picture, especially given that we have bottom of the pyramid businesses running? That, I think, is the next big step. And when that happens, then the multiplication factors probably are going to go way up beyond the 12 to 15. And I think that's actually what this year, starting next year, I would say at 2021, is one of the aims of our organization, is to start to both deploy that kind of capital right at the very, very bottom of the pyramid. And I'll go back to what David Beasley said. That's the solutions that will cause lasting change. You bring private sector, you bring, frankly, Wall Street in this case into play, and then you bring local players. But the organizations like David's organization, Blue Cross, Victor, Opportunity, we are the glue who brings it all together and make sure that we stay focused on the needs of the millies of the world, right? I mean, you don't ever want to forget not the face of your beneficiary, but the beneficiary themselves. There are people who are going to bed hungry. There are people who are starving, and that shouldn't be, in God's economy. That's not what he planned. So yeah, so thank you for the question.
Thank you. I'm being told that we need to wrap up now, and I want to thank this panel. I think we addressed a lot of different issues, and it is my belief that unless we're thinking comprehensively, we aren't going to achieve world peace. We're going to see more destabilization in communities, and it's this kind of work that is truly the key to the future that we want to see. So thank you to all of the panelists. Thank you to esteemed Mark Ricci for giving us this space to share our stories, and to Global Minnesota. And with that, I will officially end this session.
Thank you so much to all of you, David, Atul, Victor, Alexandra, because you brought the whole day's message together, that we find in our own paths, our particular skill, our particular passion, but we know that we have to do it in partnership, but not just in silos that are partners with each other, but by integrating and bringing these pieces together. Victor gave us a big picture about how that's being perceived in one of the largest and most important countries on the planet. Atul talked about all of the different experiences from his work all across the globe. And David gave us a sense of how those SDGs right here at home can guide a large health system, but also can bring the team members, the employees, the people in these organizations into the larger SDG movement, sustainability movement, and take it on. And Bountifield International will be doing one of the social hours after today, after the session. So I want to urge people who want to learn more and see more and engage in a conversation in that more informal way, please check out that part of the Global Minnesota website. Go to the World Food Day under agenda. There's a whole list of social hours. But this obviously is a conversation about the work taking place on the front lines. Thank you for taking time away from that work, because I know how important and how just gratifying that is, but how it takes you into a whole different type of schedule and a whole different type of opportunity. So being here today is a big deal. Thank you so much. And thank you, Alexandra, for pulling it together and moderating us today. We will be back in just a couple minutes with our final panel, where we're going to look forward, the countdown to 2030. How do we get there from here? Thank you again.